Hey,
Hi.
Dr. Sarah.
Hi, Dr. Gatta. How are you?
Wonderful. How are you?
I'm doing well. Thank you so much for hopping on this call and taking the time to answer some questions, talk about hydroxyapatite and RiseWell.
Thank you for having me.
Yeah. How's the weather in Florida?
Fantastic. It's always sunny down here, and that's why I moved down here from the Northeast, where there's no snow and no winter.
Yeah, I know. I feel like it's finally lightening up the weather, so hopefully we'll get some sun, some more sunny
Good,
days.
good, good.
So I just wanted to start off by thanking you again and then having you sort of explain a little bit about what you do and a little bit about your practice before we jump into RiseWell.
Sure thing. So I went to dental school down here in South Florida. I was on a military scholarship. I worked with the U.S. Navy for 8 years and did a prosthodontic residency with them, and got to serve all over the U.S. and internationally as well, and came back to South Florida in 2017. I joined a great restorative office here in Boca Raton, and I primarily focus on full mouth rehabilitations as a prosthodontist and some of the cosmetic sides of restorative dentistry, and just gives me a great kind of joy to give people back their self-confidence with a new smile.
That's amazing. And the name of your practice, Innovative Dental Aesthetics, where did that come from?
Well, I wanted to really help give people the indication of what I do. I think I love my dental colleagues, but we really do not do a good job of marketing ourselves. People really have no idea what the difference is between a lot of practices. So I wanted people to understand that as a prosthodontist, we're using innovative solutions and materials, trying to be minimally invasive and conservative, while also focusing on wellness and aesthetic outcomes here. People want comfort, function, and aesthetics, and that's really what I focus on here in South Florida. So the name of the practice tries to combine those elements that I want to market to the local population so they know how best we can serve them.
That's amazing. And I'm sure they're so appreciative that you're trying to combine whole body wellness, whole body function with aesthetics. And it's not either or, you can have both.
Yeah, a lot of it goes back to patient education, and it's funny, a lot of people don't understand when I'm working with them why I routinely talk about nutrition. They're like, "Oh, doc, just fix the caries, fix the decay," and I really want to help empower them that, like, no, Mrs. Smith, you have the power to break the cavity-causing cycle. It's not just bad genetics or soft teeth. Like, you have the power to break this cycle once you understand how nutrition affects the demineralization process, and it's reversible to an extent, and really give the power back to the patients.
Absolutely. It is multifactorial too, like you were saying. There is a combination of factors. A lot of them are controllable. I mean, you mentioned a couple with diet and with hygiene and also what you're putting in your body, but is there some other things that can affect the outcome of caries risk as well?
I think one thing that is often maybe overlooked is looking at dry mouth. So here in South Florida, we have a very high abundance of a geriatric population, and a lot of my patients are on the older or mature spectrum, and a lot of them take prescription drugs. And one of the unfortunate side effects of prescription medications is xerostomia or dry mouth. Unfortunately, a lot of people don't realize the interplay between dry mouth and the demineralization process. So when you lack saliva, unfortunately, the pH is going to drop, meaning the acid goes up, and they're just prime candidates for recurrent caries, root caries, and it just creates a really inhospitable environment for the mouth. And without saliva, it's hard to recharge and remineralize any incipient lesions. So really just continue to talk to patients about, yes, the interplay of nutrition, the interplay of dry mouth, and the importance of saliva, getting them on remineralizing mints, getting them on gums that are sugar-free, anything to help stimulate saliva in the body.
Absolutely. And I see that in the pediatric population. As a pediatric dentist, one of the common side effects of mouth breathing that we see is dry mouth. And I tell parents that's putting them in a high risk category for cavities. It's one of our red flags that we have when we're evaluating for maybe needing expansion. And airway evaluation is, do they have chronic cavities? Because diet could be great and hygiene could be great. And then if we're mouth breathing, we're in a high risk category and we're getting cavities no matter what. But something that I do tell them that they can impact positively as we are getting through the airway expansion process in the meantime. And the number one question I get, number one by far, what toothpaste should I use? So that's kind of where you come in. I want to talk a little bit about RiseWell, the inspiration behind it, and kind of talk about what goes into it and how picky are you about what goes into it?
Well, thank you. Great question. I also recommend RiseWell to my patients, and I think the story really goes back to around 2017. I was working with my sister and brother-in-law, and they were in New York City in the financial world and wanted to help bring a product to market, and they were talking with me in the oral hygiene space, and we saw an opening where I think current products at the time, it's like you either have traditional big box companies with, you know, the ingredients that they use, or you have other companies that have less chemicals but really not the efficacy you want. So to try and find the balance of efficacy and minimal detergents, minimal chemical load, that was the opening we saw as a niche for ourselves. And my sister was going through some health challenges at the time that she's been very open about, having polycystic ovarian syndrome, making it hard for her and her husband to conceive. And they were working with an IVF specialist. And he's like, guys, you're spending a ton of money on this process. You might want to take it seriously. And they're like, oh, right. Yeah, true. So, you know, they ran home, they focused on nutrition. It's like, yes, get rid of all the ultra processed foods, all the things that you really don't need in your body and in your system. And then they also started thinking about the beauty products, the potions, the lotions, the things that go on your skin, oral hygiene products that go in your mouth, the oral mucosa, so it's a highly absorbent piece of skin. And really just trying to live a more healthy, clean lifestyle. And not that that had a direct relationship on their odds of conceiving, but just trying to overall, why have unnecessary chemicals in your life if you don't need them? And, you know, fast forward, they were able to start their family and have a beautiful, healthy baby boy. And that's kind of where I came in as well, in terms of talking about, all right, to try and create a product that has both efficacy and lower chemical load here in the environment. And also patients here in South Florida, very high dental IQ, very astute folks that have very intelligent questions here. And they were looking for options as well that were able to just be more healthy and clean and just get rid of unnecessary detergents.
That's really incredible. And so let's talk a little bit about what goes in RiseWell toothpaste and what is left out of the toothpaste.
Absolutely. So hydroxyapatite is the backbone of what we're using here to help support the enamel. Also, we're using non-GMO corn-derived xylitol to help starve the bad bacteria. We're looking at opportunities to minimize exposure to alcohol. The pH balancing mouth rinse doesn't use alcohol because we don't want to over dry the oral mucosa. So those are some of the ingredients that we try and focus on here. Also, eliminating things like triclosan, which has been banned in hand soaps in Europe, getting rid of sodium lauryl sulfate. I don't think folks realize that sodium lauryl sulfate, it's a detergent. It's used in many shampoos and cleaning products to create the suds and the bubbles, like it's effervescent and working more. But you really don't need that. It's just kind of a marketing trick to create this illusion of efficacy, but it's an extra detergent. You don't need it in your system because it helps to impair fibroblasts. Fibroblasts are super important in the healing process. So if you just had mouth surgery or an extraction or implant, sodium lauryl sulfate is just slowing down that healing process, and you really don't want to do that if you just had a recent surgery here. So we try and cut out the bad and add ingredients that help support the enamel in a way that is beneficial to our patients.
One of my, you guys are actually one of the OGs, the original to the hydroxyapatite market in the US. And I'm just really impressed that so much research has gone into the products that you create. And can we talk a little bit about the hydroxyapatite, where you source it from, and why this distinction is so important?
Well, it's a great point. Well, thank you. I do think we are one of the OGs in the space. It's funny when you go on Amazon now. There's probably over 20 plus people in the hydroxyapatite toothpaste space, and it's great that this message has been resonating since 2017. and getting out to the general population. So we support that. I mean, but going on Amazon 5-6 years ago, it was a lonely crowd here, and I was kind of nervous in the beginning putting my name on hydroxyapatite because it was really not something that we spoke about in dental school. It wasn't really offered as an option. It was just fluoride is the religion, and you get on board. And we know it works. We're not against it, but I think there are different alternatives out there, kind of like amalgam fillings work, but no one really wants amalgam fillings anymore. So that really created an opportunity for us to differentiate ourselves and use something that we found great research in. So when we first launched, we're working with a consultant. And again, I had, before researching it, I really had not heard of hydroxyapatite much besides maybe 1 hour lecture in oral histology first year in dental school, looking at the bell and the cap stage of enamel formation here. But after really diving into the research, realizing that hydroxyapatite is able to help support the enamel, help with sensitivity, help with whitening effects, and I was really blown away by the opportunities that were before us here. And that gave us confidence to move forward looking at hydroxyapatite in a toothpaste. And so we source our products from Fluidinova for the nano-sized particles. Their facility in Portugal that went through a rigorous 8-year safety study for their nano-hydroxyapatite. And for the micro-sized particles, we also source in Europe.
Great. And so the SCCS approval in Europe, that's a really high standard. And so that the particles that we are getting, I know everyone kind of has this knee-jerk reaction to lab-created nanoparticles are lab-created, but they are so much more efficacious in terms of remineralization and hypersensitivity and whitening. It has a nice whitening effect too. And so the SCCS approval that you have is really phenomenal, and it just shows that you've taken the time to make sure the products have quality ingredients in them. And then I wanted to see how you feel RiseWell is a part of overall, an overall balanced experience. And you have a lot of holistic families, they eat really well, but how do you see RiseWell being part of their overall daily habits?
Well, you bring up a lot of great points there, and I want to just touch on the SCCS certification that Fluidinova has achieved here. And look, there are probably other great safe laboratories out there, but we just didn't see publicity on those at the time here. And when we first started, we were not a nano-hydroxyapatite company. We used micro-sized particles because we didn't have the research at the time giving us the confidence that nano was going to be the direction the profession was going into. After the 8-year safety study was released and evaluated in 2023, it's like, aha, okay, it gave us confidence that there's actually some research behind this here. And so that's when we entered the nano-hydroxyapatite space as well. And actually, I was just in Portugal visiting the facility with Dr. Paulo, and just had a great conversation with the folks over there and meeting the scientists and seeing the facility. So it was really great to go and visit our vendors up close and personal, and just getting a tour of the factory and the facility, and just looking at the care and attention to detail they use when they create their products here. So it was really a good experience.
And it doesn't hurt that it's in Portugal.
It was great. It was great. I had never been. It was wonderful to do a little side wine tour excursion as well, and just to look at the whole Porto region and the Douro Valley, and it's just a wonderful spot. So I highly recommend it.
That's incredible. I want to talk a little bit about the micro and the nano. So you have 2 different lines of toothpaste. And the percentages, let's talk about kind of how much you have in the micro and the nano, and why those percentages matter, and then why the 2 lines. And then after that, I want to talk about the flavors, because I have a pediatric population and the flavors matter.
Absolutely. So again, the 2 lines, the professional line is the combination of 10% micro and 5% nano Zim Fluidinova's hydroxyapatite. And we like to use that because both provide efficacy, both help to support the enamel. Again, nano-sized particles, they are smaller, so they're able to actually fit into the dentinal tubule to help with enamel support, and with sensitivity, which is a great side benefit that I really had not even thought about beforehand. But after using some of the prototypes and some of the different formulations, I noticed several weeks later, it's like, wow, this really has a great sensitivity relieving effect compared to the traditional big box companies that use another ingredient. So that was a wonderful side effect as well. With our traditional line, we're using 10% micro-hydroxyapatite from a calcium carbonate rock we mine in France. And also the research shows that it still is very effective in helping with sensitivity and with enamel support, even though the particles are a little bit larger, so they don't actually go into the dental tubule, but on the outer surface of the enamel, creating a reservoir. So when demineralization occurs, you're getting that layer of that newly lined hydroxyapatite kind of demineralizing first, providing a source of calcium to help to recharge the saliva.
Which is what our enamel is made of, the enamel matrix. It's made out of that hydroxyapatite, which is nice because it's replacing and replenishing versus, other ingredients that are used, deposited in other areas, and, you're actually replacing. But this is a direct, even adherence to the enamel that we already have.
It is, and we were looking at several different options because hydroxyapatite, it's 10 molecules of calcium, of 6 molecules of the phosphate, and 2 molecules of hydroxyl. So when you're looking at these different combinations here, there are other combinations of calcium and phosphate out there, like tricalcium phosphate and other derivatives of just putting calcium and phosphate together. But we realized that the version of hydroxyapatite, it's the closest to what the human enamel is already made out of in that hexagonal crystalline structure here. And so that's why it's so amenable and compatible with human enamel when it adheres to it, because it's just very similar in the orientation and structure. So that was a really nice benefit when we were able to research that.
And it is a crystalline structure, and I have a background in chemistry, and I know that crystalline structures like to be layered and even, and so it makes sense that if it has a similar orientation, it's going to adhere and like that, crystals like structure like that.
Absolutely.
My next question for you was about the flavors. Why the limited line? This was a bone I had to pick, but I understand now, and I just want everyone to understand why we are limited in terms of our flavor choices, but I think it's actually a really smart reason behind it. So do you want to explain?
Well, so again, traditional line is wild mint. We have a kids line too, which is cake batter, which is seriously delicious, and I catch a lot of my adult patients using it as well. And besides the taste, there's no different in the chemical formula. It's just a mint or a cake batter with vanilla extract, but everything else has the same properties of xylitol and hydroxyapatite. And again, I'm always open to feedback, and sure, it's a point of contention with some of our loyal following people here that we have 2 flavors. But when you're doing something well, why deviate? It's working, it's helping so many people here. And yes, we could launch more flavors in the future. And I know a lot of the other people in the space have a wide swath of flavorings here, but we like to concentrate on what we're good at. And we're good at these 2 flavorings here. And also we want to try and minimize the ability to have unnatural or just artificial flavoring in our products here. I was really surprised to learn that when you go to these different flavor house companies, sometimes when you ask for natural flavorings, they're not required to tell you what's in natural flavorings. And so that was a line that we weren't going to cross and take a chance on, because, okay, we can put on the label it has natural flavors, but the flavor house won't actually tell us what's in that. And so we had some trepidation on moving forward if we couldn't provide the transparency to our followers about what we were putting in our products here. So for now, we're focusing on what we do well, which is wild mint and cake batter. And there might be some surprises in the future here, but for now, we're just concentrating on what we do well.
I love that. Can we talk briefly about the mouthwash? What's in it, and why can't we have hydroxyapatite in it? I get these questions a lot, so I'm just fielding from my...
It's a great question. It's a great question. So you can put hydroxyapatite in a mouth rinse. The problem is, and you may see from other companies on the market, it doesn't stay in solution. It precipitates out, and at the bottom of your mouth rinse, you see a cloud of HA crystals. And just from an aesthetic viewpoint, it wasn't really the experience we were trying to provide for people. There's not a great natural way to get it to stay in solution without adding chemical emulsifiers and processes that we just weren't really comfortable going down that road. So some companies do it. It's not what we focus on. We like to focus on enamel support using our varnish and our toothpaste. For the mouth rinse, we're using alcohol-free. We're using xylitol to help starve the harmful bacteria. And also, we want to create an environment that raises the pH. You want to get the pH out of that dangerous 5.5 zone. That's when demineralization starts to happen, below that 5.5. So with sodium bicarbonate, you can raise the pH into a more neutral, slightly basic environment where you're not going to have the demineralization occur. You're going to create a super saturated environment where it's hard for decay to happen when the pH is elevated. So that's kind of our philosophy on that, based on the available research that's out there.
Perfect. And the floss has the HA in it. Can you talk about that?
Absolutely. Yeah, so it's a polyester filament with wild mint oils and the xylitol and the hydroxyapatite infused into the woven particles here. So when you're flossing, it's great to try and help deposit HA between the teeth. That's where a lot of decay and caries process starts. I know flossing isn't fun for a lot of people, but for all the people listening, it is still one of the best ways to clean in between the teeth. Mechanically swipe away debris, try and deposit some HA between the teeth to initiate a super saturated environment to support the enamel. And that was kind of our philosophy on the floss. And we try and have a more robust strand here. You'll notice it doesn't glide between your teeth the way some other people's do, because we don't put PFAS in our floss. So it's a more robust, scrubby floss. So we wanted an environment where when you go between the teeth, it slightly expands and tries to grab more particles mechanically. So it does take a moment to accommodate the new robustness of the floss, but a lot of people are enjoying it, and that was kind of our philosophy on how to help clean between the teeth.
That's great if you have a black triangle, which is just an area where you have gum recession. For people who don't know what a black triangle is, just between the teeth. As we age, or if we are in ortho, we sometimes have a little bit of recession. So that scrubby floss is great for getting in between and making sure we are really debriding between the teeth and you're depositing
100%.
It's so fantastic. And then the bamboo toothbrush, you guys really have a whole system. I'm going through each of them because I'm just so impressed by them, but I love that you have a bamboo toothbrush. It's a renewable resource, but you're also reducing microplastics in the mouth. Kind of what was the inspiration behind it? It's really well thought out.
Well, thank you. Yeah, we try to minimize plastic in the environment where it makes sense, where possible. And a bamboo toothbrush was something that it was a wonderful opportunity to try and, again, decrease the level of plastic in the environment. And it was just a renewable way to try and just have a more sustainable experience for our customer base, just getting rid of plastics where possible. And we wanted super soft bristles. And so I think that's one thing too that takes people a moment to accommodate and get used to, because I think a lot of people think if my gums don't bleed, or if I'm not really cranking and brushing, then I'm not doing a good job cleaning. Where, I have a lot of patients here, they're super successful, type A driven people, they think brushing harder is brushing better. And I really have to reorient their motivation to say, hey, you should be brushing like you're brushing an overripe tomato and you don't want to break the skin. Excuse me, you don't need a ton of force to do a good job. Just light brush strokes, angled toward the gum line, circular motion, removes debris mechanically without accidentally inducing recession or irritating yourself. So that was kind of the philosophy on creating super soft bristles in a non-plastic brush handle.
I always recommend softer, extra soft bristles, and I love that it's still so great at cleaning the teeth, but it's very gentle. And then let's talk about the travel options that people have, because we have, everyone's flying, everyone's driving, especially summertime, and we have travel options now that are available. So you can just take your hydroxyapatite on the go. There's no excuse. We have mini sizes of the toothpaste and the mouth rinse
Absolutely, yeah. We have travel sizes of the original line of toothpaste, travel mouth rinse, travel floss. We have travel mints as well for people that have dry mouth, or actually, if you can just, you actually could just substitute that for your toothpaste, where if you want to take and crush up the mint and
I
brush
happen
with
to
that
have
while
it
you're
in.
on the go. Yeah, thank you, thank you. Yeah, the AHA mints, they taste great. Just another source of calcium and phosphate to create a super saturated environment for your saliva, help stimulate and help people that have dry mouth. So that was helping a lot of people there. And also, we just launched travel size of the Pro. We have travel Pro toothpaste, which is a nice augment as well.
Yeah, absolutely. We are handing out the Pro line, and I use the mints all the time. I love it. So you can use it in lieu of toothpaste. So if you don't have everything readily available, you can just grab, or if you're flying and you don't have room for toothpaste or you're worried about it exploding, you can just take the mints with you
Absolutely,
and keep them in your bag and then use that to brush.
100%.
Yeah, because it has the hydroxyapatite in it. It has the correct concentration of the hydroxyapatite that we're looking for. What excites you about the future of hydroxyapatite? Now that everyone's on the train and people are talking about it and people are excited about it, what excites you about where you're headed with RiseWell and where RiseWell is going to sort of be spearheading hydroxyapatite in the future?
I'm just honored to really be in the conversation and in the arena on hydroxyapatite. It was very lonely back in 2017 talking about this, and almost nerve-wracking too, because as a board certified prosthodontist, I almost, not that I was embarrassed about it, but it was like, whoa, what is this guy doing, not using fluoride, using this thing called hydroxyapatite? Because despite the fact that it's been used for decades in places like Japan as a gold standard for enamel support and remineralization, for whatever reason, the big box companies here in the US never picked up on this technology or medium, maybe because it's a little higher price point, or because, when you control 90+% of the market, there's no motivation to change really. But no, after looking at the research, realizing that NASA was one of the first organizations using hydroxyapatite, it really caught our attention that, wow, that we could be onto something here. So just being in the arena, having the audience to continue to get the information out, and also trying to help people sift through what's on social media. I think social media is a wonderful megaphone to get your message out, but it's important to be backing up your message with research. And I applaud a lot of my colleagues who are doing a great job with that. I think some folks are getting a little out ahead of their skis in drawing concern to nanoparticles without really backing that with evidence or research here. It's easy to go and cause alarm and cause panic when you're talking about nanoparticles, but when you're using the correct shape, especially from facilities that have been backed by an 8-year safety study, the nanoparticles are not a safety issue. So really just being an educator in the space is what excites me about hydroxyapatite, and continue to try and get the message out there to more people looking to live a lifestyle that has less triclosan, less sodium lauryl sulfate in their toothpaste, and just living a more healthy lifestyle.
Yeah, thank you for bringing up particle shape. I meant to talk about that when we were talking about Fluid Nova and the lab that you use. What shape particle does RiseWell use for their
rod? So
Perfect.
It's a great point, and that's why the hysteria online sometimes reaches a fever pitch, because people are confounding the issue that nanoparticles are dangerous and they can go to your brain and lead to all sorts of crazy malformations. So it's important to note that not all nano-hydroxyapatite is created equal. The one molecule that was considered safe in the 8-year European safety study was the rod shape. Needle shapes were not qualified in that study. So yes, if you're using nano-hydroxyapatite that are needle shaped, certainly those probably have concerns because they didn't go through the exhaustive 8-year safety study. It's the rod shape that's most closely related to the human enamel, and that's the one that was approved. So that's why the shape is so important, because the rod shape, it was not shown to migrate and end up in different parts of the body. If you ingest it, the nano-hydroxyapatite is broken down into the calcium and phosphate, losing its nano identity in the gastric acids. People were worried about it passing through different layers of the skin. the study showed that the stratum corneum, it gets caught in the stratum corneum, and those skin cells are turning over every 5 to 7 days, and then those particles end up breaking down into the calcium phosphate in the stomach anyway. So it was not a concern, but really just understanding that when people are online talking about hydroxyapatite, are they talking about the rod or needle shape? So just having that in the back of their mind, and what source, primary source document are they referring to? Because it's easy to just get on social media and alarm people without, research behind you.
I love that RiseWell is so transparent, because the research is literally on the website. You have it's listed, it's everything is in the correct, format, and everything is there. You can just a hyperlink, you just click on it and everything opens up. There's PDFs, there's images in the articles that have been done that show before and after, that show the efficacy, and all the trials that were run. So it's really compelling evidence, and like you said, it's been around for 8 years, the research alone, and it has the European approval. You're using the lab that's been approved, and you're using the correct shape, the rod shape, which is really important. So there's little concern for it migrating into other parts, because it gets broken down before it goes anywhere into calcium and phosphate, and our body knows what to do with that. So in all senses, it's safe to swallow, as opposed to maybe other toothpastes that have different ingredients.
Absolutely. Well, thank you. We really try and provide people the evidence online here, and give them feedback about sourcing and transparency, and just be a trusted part of their family's lives.
Yeah, that's the thing I was really impressed with, was how much research played a role into what you're doing. And then I have a lot of families who are on the fence, or they're not sure about where to really get started with the hydroxyapatite journey. There's so many options now. You guys are kind of one of the originals. And I mean, this is the toothpaste that I use at home. This is what I give to my son. This is what we use. I feel very comfortable with him eating it off of the toothbrush, and I've noticed amazing effects. I have sensitive teeth, but really not anymore, and I've noticed a whitening effect and a brightening effect too with when I've been using the Pro line, which has the nano. But I have a lot of families that are still curious about it. Where should they get started, and what do you recommend for them?
Yeah, so I think, as you mentioned previously, we have a lot of resources on our website, on our newsletter, on social media here. And if you're really just looking to eliminate unnecessary chemicals and detergents from your traditional big box brand, I say step into the next chapter of oral health. I think hydroxyapatite is a great way to help support the enamel, help with sensitivity. Again, if you're someone that does not routinely get decay, you're probably fine with the traditional microhydroxyapatite. Microhydroxyapatite has also been shown to still help with sensitivity and enamel support. If you're someone who is prone to decay or has routine decay when you go to the dentist, you probably want to use our professional line that has the nanoparticles, a little bit smaller, can get into the odontotubules to help more with enamel support and sensitivity. And lastly, we have a varnish. We have a high concentration, 54% nano-sim varnish that is really aimed at the high cavity risk patient population in kids or geriatrics that are prone to decay with dry mouth. And so that is another wonderful resource to help create that super saturated environment in your saliva of calcium and phosphate to recharge and help support the enamel.
Excellent. And where do you think we're headed, just in general, as the dental field in the next 5 to 10 years? You were ahead of the curve with hydroxyapatite, so I want to hear what you think about where we're headed.
Well, I'm continued to be excited about advances in peptides. I think peptides have been all the rage in certain other aspects of whether it's weight loss or overall diabetes management. I think looking at how peptides might be able to help with remineralization and enamel support in the oral environment as well. There are companies and researchers working on self-assembling peptides that help to support the enamel and remineralize. And that's a direction I'm looking at and seeing what might be open for opportunities in the future for that, seeing if peptides can continue to help us on our quest to remineralize teeth.
You guys heard it here first, peptides. And then I'd love to have Corey on at some point. Talk about her experience, her journey. And yeah, I know she's had a very, very interesting sort of path that led to RiseWell, and having you on as well to be part of the team. It has been so impactful and important to have a professional in the dental field to be a part of that journey.
I have her number and I might be able to facilitate that.
Wonderful. We might bring you on again too. It was wonderful having you. Are there any last things, anything I forgot to mention? I think we pretty much covered a lot of it. I have all the products behind me here. We use it in office, I use it at home. And yeah, we've been really happy with it. Our patients absolutely love it.
Well, again, I appreciate the support and time to talk to your audience and help them on their quest for improving oral health. And we did just launch a varnish in the cake batter flavor. So we originally launched the varnish in the wild mint. I know kids, sometimes it's a little strong for them, that taste. So we have cake batter in a varnish, which is the high concentrated 54% nano-zim nano-hydroxyapatite. So we're getting a great response across the country in the pediatric world for that. And it's just helping a lot of youngsters.
Yeah, and that's a nice alternative to some other things. And you can apply it in your tray. If you have clear liners, you can use that to sort of reinforce the enamel.
100%. But yeah, you can check us out more at RiseWell.com and check me out on Instagram at Dr. Derek Gatta. I'm happy to help you on your quest.
Excellent. And I will make sure when I post this that I tag your socials so that everyone can go follow you. And your practice name again?
Innovative Dental Aesthetics in Boca Raton, Florida.
Oh, I mean, the best place on earth, really.
Yeah, you gotta go check it out.
I think we should take a trip. Thank you so much for your time and your expertise. Really appreciate you coming on here with us.
My pleasure. Thanks, Dr. Sara.
Thank you. Take care.
Bye-bye.
Bye.